Hi guys, today we'll be talking about whether and when to buy a Marrow or a Prep Ladder or any other subscription for that matter. I'm a final year medical student and I will be only talking about what I think is the best for both NEET PG Prep and your knowledge base in general. So if I have to summarize, आपको मैरो या कोई सब्सक्रिप्शन लेना है तो आप वो थर्ड ईयर के स्टार्ट में लीजिए, उससे पहले नहीं और उसके बाद में ले सकते हैं, बट ideal time for me I think would be starting of third year. Reason being, first and second year में you need to get a hang of reading books, medical books, क्योंकि उससे पहले पढ़ोगे तो उसकी आदत लग जाएगी. The thing is, Marrow is definitely sufficient to pass you, or maybe like at least for the theory part I'm guessing it's sufficient because I myself have not done it in the first second year. But what I think the problem would have been, I would have been hooked to only Marrow, and मैं जितना books पढ़ा भी हूँ उतना भी नहीं पढ़ता. First thing what you need to do, for the first year at least, you are not supposed to buy Marrow. Second year also don't buy Marrow, please. You could. I am just saying, kid, you need to understand what type of a student are you. क्योंकि सेकेंड ईयर में अगर तुमने मैरो खरीदा एंड तुम अगर मैरो से ही पढ़ रहे हो एंड नॉट फ्रॉम द KDT और रॉबिन्स और हर्षमोन और एनी अदर बुक्स, स्टैंडर्ड बुक्स फॉर दैट मैटर, अगर तुम मैरो से ज़्यादा एक्लेमेटाइज हो जाओगे, अडेप्ट हो जाओगे, देन योर knowledge depth won't have a it won't have a depth. It will be all mugged up information in your head. Second year में I studied pretty seriously from my standard books and I'm pretty confident in those subjects. And you could always study these first and second subjects, first year and second year के subjects later when you revisit them in your third year, fourth year or your internship, right? उसके पहले तुम खरीदोगे भी तो I think या तो you will realize you won't pass with Marrow and you will have to study from books. तो तुम्हारा वो 20-30K का extra investment would go to waste. And professors, and definitely they know where and when to test what students. They know about all the coaching apps available and what they would not teach. So first year में तो get used to medical life, get used to reading books and giving exams and vivas. Second year में make sure you have really good knowledge depth. Make sure that because your medicine is a combination of pharma and patho will come up in pediatrics, it will come up in your surgery and everywhere. So having a good patho base will really give you an edge over your version of the person who would have just relied on Marrow. I'm not knocking on Marrow. The only reason and place where you should buy Marrow is where you know and you have enough mentorship and you know exactly how to use Marrow, and not to use it as a main source but as an addition to your studies. क्योंकि तुम मेन तरीके से उसको नहीं पढ़ सकते, उसको आपको एडिशन करना पड़ेगा. क्योंकि फर्स्ट सेकेंड ईयर में आपके क्लिनिकल रोटेशन शुरू हो जाता है. गेट यूज टू द क्लिनिकल रोटेशन, गेट यूज टू द फीलिंग ऑफ बीइंग अ डॉक्टर. नीट पीजी के बारे में आप सेकेंड ईयर के बाद में सोचना शुरू करना, एंड दैट इज़ मोस्ट. एंड तुम टॉपर इंटरव्यूज सुनो, मेरी बात मत सुनो, मेरी बात बस सुन ली, बस इतने तक रखो. पहले लेना है बाद में लेना है. आई वुड इवन से कि नीट पीजी है इसलिए तुम्हें खरीदना है. अगर नीट पीजी का कॉन्सेप्ट नहीं होता कि तुम MBBS डॉक्टर ही हो, देन आई वुड नॉट इवन से कि तुम्हें मैरो या कुछ सब्सक्रिप्शन लेना चाहिए, राइट? थिंक ऑफ इट इन दैट वे. व्हाई इज दैट? because we think कि it won't have a depth to it, right? We are studying from Marrow or prep ladder or anything is to clear that exam, okay? Because you don't want to take a drop year in the future, and that makes complete sense. You do what makes sense to you. I have friends who have bought Marrow in final year. I have friends who have bought it before it. And most of the people buy it around the third year. So the way you reach at that conclusion is not to not listen to people, but it is to listen to as many seniors as possible and teachers as possible, and then think of what suits you the best. If you're willing to take a drop year and realizing that 1 year where I can do a job somewhere and then prepare for it in my drop year, then buying it later in your MBBS makes more sense for you. And if you want to clear it in the first go, then buying it in the third year, starting of the third year, makes more sense. As the competition is rising, that is the sad part about competition, is that you have to buy it a little early to have an edge. And that is completely okay if that is what your aim is, but do understand where the depth of the knowledge, where you lie with the information that you're gathering. Don't let it be superficial, because at the end of the day, at some day your exam will end, and at some day your subscription will get over. What you will just remain with the knowledge that you have assimilated in your MBBS. And reading books is fun. Reading books like Davidson, Robbins is fun. And to inculcate that habit of having fun, reading a longer format of book, like a story book, is what needs to be inculcated in every one of us, even me. But this is something I wished I heard from someone this directly. So this is it for today's video. Do tell me if it makes sense.